Hello. Well, it has been a little while, hasn't it? I think 2 months since I did a video talking about my breast cancer journey. It's been 6 months since I started anastrozole, and I was talking about that. And really, so far, so good. Still, I'm pleasantly surprised. So, why I'm coming on today is I want to talk about this little apparatus right here. Do you see that? It is a heart monitor, and I want to discuss why you may want to know why I'm wearing this. Hi, I'm Kim Tisor, and welcome back to The Good Place, where I promote what is good in the midst of life's hardships. And you may have heard me mention before that the whole reason I started this channel, when was it, a year and a half ago or so, was because I was diagnosed with a breast cancer recurrence, and then lost my job, and my husband was rear-ended, and our vehicle was totaled, and I had surgery and medical bills, and everything was just looking a little sad and depressing, and I needed something to fill my cup. And having a background in media, and I had the time on my hands to do it, I thought, why not start a YouTube channel and focus on what is positive to help feed my soul and to encourage me. And anyway, so that's why I'm here today. So, okay, back to this little device I'm wearing. This is a heart monitor. And maybe you have heard of something called radiation-induced heart disease. This is something that can develop if you have had radiation for a number of things, but certainly for breast cancer, like I did. And my radiation was concentrated on the left side, right near my sternum, close to my heart. Well, back up. So for the past few months, I've been having a lot of heart palpitations and different sensations of my heart flipping and flopping and squeezing and you name it, which I have to tell you isn't completely unusual for me. I have dealt with heart palpitations since I was young, teenager, maybe younger, for almost as long as I can remember. And I kind of thought it was normal. I mean, I had gone to a couple of different doctors in my lifetime about it, and they weren't much help. So I just kind of said, I guess it's the norm. Well, right before I was diagnosed with the breast cancer recurrence in February of 2023, so in January of 2023, I was diagnosed with something called an atrial septal aneurysm, which is a deformity in your heart. And from what I've read, it can lead to the heart palpitations. And I thought, well, that would explain maybe why I've had this all these years. And because of that condition, my radiation oncologist was concerned about giving me radiation treatment for breast cancer without first visiting a cardiologist, which I did. And I got the green light that, hey, it's okay to do it. So I had it. But again, in the past few months, I've experienced an increase in the amount of these palpitations that I have. And if you've experienced this, you know what I'm talking about. And please let me know of your experiences in the chat section. But they've been increasing to several times a day. What was once maybe once or twice a week seems like several or multiple times a day. And so I brought it up to my oncologist back in December when I had my regular scheduled checkup with her. And she said, we really should have this checked out. So she referred me to a cardiologist I had not seen before. And I saw him just the other day. And thankfully, he's not too concerned. And this is what I want to share with you. He said that usually when he sees heart conditions that arise as a result of radiation, what he sees is coronary heart issues down the road, years down the road, not what I'm experiencing with the heart palpitations, etc. However, I did have this pulled up. Let me see if I can find it for you. So this is radiation-induced heart disease defined. It is a condition that can occur after radiation therapy when the heart is unintentionally exposed to radiation. It can cause damage to the heart's valves, muscles, and electrical system. So some of the symptoms, again, according to what I'm seeing online here, obviously if you're having any heart symptoms, see your doctor. Chest pain or discomfort, shortness of breath, dizziness or fainting, irregular heart rhythms, hello, swelling in the legs, ankles, feet, or abdomen, feeling tired and weak, got that, but that could just be age related, dry cough, and nausea. So I'm obviously having some changes to my little electrical system, but the doctor, at least Didn't think I was going to walk out the door and suffer from a massive heart attack or stroke. So I was really encouraged by that. Maybe you are as well if you've been having heart issues. So, all that to say, I'm going to wear this little device for a week and it should be monitoring all of my heart's functions, and we'll see how it goes. Then I mailed this back in and then should have results in a few weeks. So we're really looking at the end of February before I have results to know if my heart is acting somewhat normal or if something needs to be done. But this is just one of those things that we as women in particular, I mean men as well, who go through breast cancer treatment, whether it's chemo or radiation, the things that we can suffer from down the road. And so I want you to be familiar with that if you're not, if you've had radiation. And what the doctor pointed out, and is true, is that radiation treatment has come a long way. They do things to try to protect your heart, but obviously sometimes it can get damaged. So I appreciate your prayers. I'm praying all is well. I pray all is well with you. I'm sorry it's been so long. And if you're one of my friends who is on anastrozole, I hope you're doing well on that. I've been on it, like I said earlier, for 6 months now. And so far, I don't have a lot of side effects. My hair was falling out for a while. It seems to have stopped. So I've had some thinning, but I mean, I still have hair on my head. And even if I didn't, I can always get a wig. There are some nice ones out there. And my back has been a little achy, which it has been from the beginning, but part of me is starting to wonder if it's not my mattress. Maybe it's time to get a new mattress. So I know a lot of women do not do well on these AIs, aromatase inhibitors. They do better on tamoxifen, but for me, it was just the opposite. So it's one of those things you never know until you try. And obviously, I'm not a doctor. I'm not encouraging you to take something or not to take something or to have radiation treatment or not have radiation treatment. I mean, I struggled with the decision to go through with it myself. I mean, I agonized over it for a while before I decided to have it. I trust that, it hasn't damaged my heart. And if it has, well, all I can say is done deal. I mean, I prayed about it and I did what I thought was best. And that's all we can do, right? When there's this situation, you pray and do what you think is best and hopefully have really good doctors that you can talk to and trust as much as possible. We'll just put it that way. And that's it. So hope you had a blessed Christmas, a blessed New Year, that you're looking forward to good things in 2025. And I hope you'll come back, check back in, and say hello sometime. God bless. Take care. Bye-bye.